I would love to thank everyone for taking time to join us today. My name is Scott Yeager. I am the outreach manager for a brand new agency here in Pennsylvania. We're Penny. We're the Pennsylvania Health Insurance Exchange. And if you haven't heard of us yet, you will. You will. We are the official replacement for healthcare.gov here in the Commonwealth of Pennsylvania. And we are helping a lot of people get protected. And what I'd like to do is go back in time just a little bit to explain to you how we became an agency here in Pennsylvania. Everybody's heard of healthcare.gov, or most people have heard of healthcare.gov. That's our federal marketplace. The federal marketplace has some advantages. It was the first marketplace here in the United States to help drive the Affordable Care Act forward. Okay. And the Affordable Care Act has many advantages. Number one, it guarantees that there is a high level of quality in terms of the health insurance that's sold through marketplaces. It also provides individuals with an opportunity to get insured regardless of whether or not they have a pre-existing condition. And for individuals who are under the age of 26, they can remain on their parents' plans. That's, a pretty good idea. However, prior to Penny's legislation, the Commonwealth of Pennsylvania was sending a check for $98 million every year back to healthcare.gov. And in 2019, there were a group of forward-thinking policymakers and legislators from both sides of the aisle that got together and said, you know what, we can create our own health insurance exchange here in Pennsylvania that is competitive. And anytime there's competition in the marketplace, it benefits the customers. We can also create a regulatory structure, which is known as a reinsurance program that, like the thermostat in your home, it helps regulate what the premiums and rates are in the individual health insurance market. Ultimately, what happened was something that was incredibly unexpected. Because bringing the marketplace home to Pennsylvania meant that we would have a competitive marketplace, a marketplace that was tailor-made for the Commonwealth of Pennsylvania, and that we would work with the health insurance carriers here in the Commonwealth of Pennsylvania to make sure that people could actually afford health insurance on, or I should say, under a unanimous bipartisan effort that passed both chambers of the Pennsylvania General Assembly and was signed into law by Governor Wolf on July 2nd of 2019. Penny's legislation, what gave birth to this new marketplace here in Pennsylvania, was something that was actually good for everyone. So with that being said, I'd like to fast forward to our inaugural open enrollment, which was November 1st of 2020. That was when Penny was born, so to speak. We had a few things that were mission driven here at Penny. Number one, we wanted to become that official replacement for healthcare.gov, and we have. We wanted to be the home for high quality, affordable health insurance in the individual health insurance market here in Pennsylvania. And we also wanted to find our customers in a position where they still qualified for financial assistance, because let's face it, you can have the best health insurance options, but if people can't afford them, or even worse, if people cannot afford to utilize them, basically what you have is you have a boat on dry land. And Penny wanted right out of the gate to be something that was relevant to the 607,000 uninsured here in Pennsylvania. That's about 1 in 20 of our friends and neighbors who every day they wake up and they go out into the world without health insurance. And if 2020 and 2021 have taught us anything, there are a lot of individuals who are in employment transition right now who don't have access to employer-sponsored benefits. There are individuals who they may be working a couple jobs and not have access to health insurance through their employer, nor do they qualify for Medicaid or CHIP. And in some cases, for individuals and couples who might not have yet aged in to Medicare options, people need options, and that's what Penny's here to do. We're here to help provide those options. We also at Penny, we have a no wrong door policy, and that no wrong door policy is important because if you have somebody reach out to Penny and it's determined that they're better served by actually being connected with the Department of Human Services and applying for Medicaid or CHIP, we have a very warm transfer process that helps people get connected. And not only that, but we also provide the Department of Human Services and vice versa. They provide us with application information. So we're trying our best to make sure that there are no bumps in the road when it comes to actually getting people protected, because that's what matters. So through 2020 and 2021, we've done our very best to try and help individuals who don't have access to Medicaid or CHIP, who don't have access to Medicare options, who don't have access to employer-sponsored health insurance. We're also here to help the small business owner, the sole proprietor, the small precision manufacturer, individuals who are here lawfully present, either on a path to citizenship, or individuals who are here who may be here on a student visa or a worker visa. We're here to help support agribusiness in Pennsylvania. And again, our goal is really, really simple. We want to see people protected. That's what matters most to us. And we do so through a couple different ways of support. And how we help is we have a dedicated online self-service portal here at penny.com that literally can help somebody who doesn't know the first thing about health insurance get from a point of, I really know that I need insurance, but I'm not sure quite how to approach that. And I mention that to you because we recognize the fact that not everybody in this world, in fact, hardly anybody, possesses an inherent knowledge of health insurance. It is a complex subject. It's a subject where if you walk into a room and start talking about health insurance, people are going to look at you like you gave them a glass of lemonade without the aid part, and justifiably so. Justifiably so. There's a lot of fear, a lot of misunderstanding, and a lot of apprehension about health insurance, but Penny's here to help change that. In addition to our online self-service portal, we have customer service representatives here at Penny. They do not work for insurance companies. They work for the residents of Pennsylvania. They're here to help answer questions in an unbiased, no hassle manner. They can literally work with a customer through understanding what financial aid options they qualify for, all the way through to actually securing health and dental insurance. But there are local support structures that we have here at Penny as well. We have hundreds of Pennsylvania assisters throughout communities in Pennsylvania. And again, our assisters are unbiased professionals who are registered through the Pennsylvania Insurance Department, who are there to provide customer education and help people make the best choice for themselves and for their quality of life. But we also have thousands of Pennsylvania certified or licensed brokers that are available to make sure that if people have very specific needs in terms of medications, equipment, certain physicians, certain healthcare groups that they need within the coverage of that insurance plan, our Penny certified brokers are excellent resources that can help people make sure that they've legitimately got the right insurance for them and for their special needs. Now, you heard me mention that 1 in 20 of our friends and neighbors go out every day into the world uninsured. Every time I bring up this map, it sends a chill down my spine to know that there are that many people within each of our counties. And if you look at Bucks and Montgomery County, you'll see there's a huge chunk of uninsured in Bucks and Montgomery County. But here's the interesting thing. Between Bucks, Montgomery, Chester, Delaware, and Philadelphia, just those 5 counties represent nearly 40% of the uninsured population here in Pennsylvania. Now, I don't want to discount the fact that in some areas like Clearfield, Pennsylvania, you might only have 6,000 uninsured. Keep in mind, there's a difference in population there. So what might seem insignificant in terms of the number of uninsured, it actually can be quite significant when you take a look at the population relevant to that. I share this information with you to let you know that our work here at Penny, there's a whole lot of work in front of us. There's a lot of wood to chop. So we need all the help we can get in terms of raising awareness, in terms of making sure that people know who we are and that we're here to help. Now, over the past year, we've been able to help significantly through the American Rescue Plan. And through the American Rescue Plan in 2021 and 2022, in fact, we're in open enrollment 2022 right now. So for both of those plan years, we're in a position where we can provide a more generous level of financial assistance to people who normally would not receive financial assistance. And if you're a small business owner, if you're a sole proprietor, if you're somebody who's between jobs, that can mean the difference between being protected or putting yourself in a position where, and a lot of people lose sight of this, the number one factor for bankruptcy in the United States is medical costs that are unmanageable. Nothing in this world can literally turn your life upside down quicker than an unexpected accident, a trip to the hospital, and then the medical bills that come after that. Again, our stance right now is there's never been a better time in the history of Pennsylvania to get insured. The good news is, and we get this question a lot, the question is, okay, well, what happens, for 2023 and beyond? Well, the legislators, the policymakers are already working on a solution for that. So right now, prior to the American Rescue Plan, if you were an individual who made $51,000 or more a year, or a family of 4 that made $105,000 or more, there was a subsidy cliff that you would basically fall off of, and you wouldn't qualify for financial assistance. Well, now we're in a position where we can cap the premiums at 8.5% of the household income over that 400%. That sounds like some shifty math, but I'm gonna share some examples with you right now that'll help drive this home. Now, before I get into this, I need to explain. On Penny, on our marketplace, we have three different metal tiers. We have gold, we have silver, and we have bronze. All of the scenarios that we're going to cover are related to or relevant to Penny's second lowest cost silver plan. It's considered our benchmark plan in any market across Pennsylvania. Number one, it's really, really good health insurance. It's good coverage, it's good protection, and there are no runaway deductibles and co-payments and things like that. It's really decent insurance. This example here, the first example that we're going to look at, is an individual who makes, a little over $19,000 a year. Prior to the American Rescue Plan, this individual would have paid about $66 a month for their health insurance. Now, that might not seem like much, but if you make $19,000 a year, trust me, that's significant. Under the American Rescue Plan, for the second lowest cost silver plan for our benchmark plan, this individual pays $0 a month and saves about $792 a year. Again, if you make $19,000 a year, saving $792, almost $800 a year, that can make a big difference. Now, here's a common scenario that we've seen. In fact, nearly 36% of Penny's current customers are individuals that fall into that 55 to 64-year-old bracket. They're individuals, our friends and neighbors, our family members who have done everything right. They have worked hard, they have set money aside, they retire a little bit early, or they enter into doing consultation work. Long story short, they don't have access to employer-sponsored coverage, and they're not old enough yet to actually qualify for Medicare or Medicare options. Under this scenario, we have a couple. They retired 1 year early together. They're both 64 years old. They make about $77,000 a year in terms of their income. It's a fixed income. Prior to the American Rescue Plan, this couple, to cover two people, would have paid $2,400 a year or a month to cover two people. Under the American Rescue Plan, we cap that subsidy cliff, remember? We cap it at 8.5% of that $77,000 a year and reduce their premium to $550 a month to cover two people. That saves this couple about $23,000 a year. That's incredibly significant. That's actually life-altering when you consider somebody, individual or couple, who are aging into, the best years of their life, so to speak. Being able to save somebody that type of money it's good. It's why we're here. Now, this is a very common scenario. Family of four. Prior to the American Rescue Plan, this family of four would have paid $285 a month to cover four people, which, when you think about it, really isn't that bad. However, under the American Rescue Plan, this family of four qualifies for enough financial assistance to cover each person in that family for a little over $20 a month. $87 a month to be exact. Most people pay more for a cell phone bill or a cable bill than that. We save this family about $2,300 a year. So again, we're in a position right now where we're doing the best we can to help people get connected with good quality health insurance and savings. In fact, through the American Rescue Plan and Penny's COVID-19 enrollment period, which took place from February 15th to August 15th of 2021, number one, we were able to insure an additional 65,000 people here in Pennsylvania. But coming out of that, our current customers, about 50% pay less than $1 a month for their insurance. About 68% pay less than $50 a month. So we're doing the best we can to make sure that the word gets out. And that brings us to where we are right now. And that is, we're in a position where starting November 1st, we began our second annual open enrollment period here at Penny. 15 days from now is December 15th. December 15th is the deadline for making sure that if you want coverage in place by January 1 of 2022, people want to shop and have their insurance in place by December 15th with Penny. But because we are a state-based marketplace and we have local control, we also recognize that there are a lot of our friends and neighbors that get caught up in, the holidays and other important things during, November, December, and January. And they might not think about health insurance right away. If that's the case, Penny has its ending deadline, which is January 15th of 2022 for our open enrollment period of 2022. And it will provide an individual who applies before January 15th with the ability to have coverage in force by February 1st. Now, you'll also see here that we have special enrollment periods. That special enrollment period between January 16th and December 5th or 31st, rather, for 2022. Those special enrollment periods are triggered by qualifying life events. The qualifying life event can be anything. It can be gaining lawfully present status, being released from incarceration, getting married, getting divorced, having a death in the family, having a baby, moving from one zip code in Pennsylvania to another that might qualify you for a shift in your market, being unemployed, losing employer-sponsored coverage, being denied Medicaid, not yet being old enough for Medicare and losing employer-sponsored coverage. There's a whole laundry list of things that would qualify as a qualifying life event that throughout the year can provide somebody with the ability to call Penny or connect with a broker or an assister and say, hey, look, I just had this huge event happen in my life. I need health insurance. So I don't want people to think that the only time to have access to health insurance is during open enrollment period. It's a good time to get insured, but we know situations change. So if 2020 and 21 have taught us anything, it's that there will be change. And the good news is that we'll be here to help people get protected in that process. Now, the final thing I want to reinforce with folks is, again, we know that not everybody has a comprehensive knowledge of health insurance, but there's a lot of free help here at Penny. Our customer service center is here to support you, is here to help you. They're unbiased. They're really, really nice people. And you don't have to worry about calling them and, being sold insurance. They're really there to help you figure out the whole process. What do you qualify for financial assistance? What are the options in your market? Health and dental. They'll help you compare plans. They'll help you explore different options. But it's on your terms. It's the same way with our assisters. They work for hospitals, health centers, faith-based organizations, and they are in the community to help you make the best decision possible. Brokers are the only licensed professionals in Pennsylvania who can literally make a professional recommendation on your behalf based upon whatever your unique needs are. Down at the bottom, you'll see where we have our call center hours opened. Again, our call center, you can call 844-844-8040, Our call center is great in the fact that they can help you connect with an assister or broker in your community because we recognize not everybody likes to work over the phone. We also want to express that during open enrollment, between November 1st of 2021 and January 15th of 2022, our call center will be open Monday through Friday, 8 to 7 p.m., and on Saturday, 8 to 1. So with that being said, I'd like to thank everybody for taking time out of their schedule to spend some time with us to learn a little bit more about Penny and to learn a little bit more about Pennsylvania's new marketplace. Please understand